After the U.S. Supreme Court overturned Roe v. Wade, Governor Gretchen Whitmer, along with the state health department, have launched a new campaign. It focuses on educating the public about the difference between emergency contraception and medication abortion. 13 on Your Side's Keely Lovern spoke to a local organization focused on this information and to a local woman who had to make a tough choice for herself. And Keely, what'd you learn?
Well, Juliet, what I heard most of all today was that people on all sides believe there's so much misinformation being spread about abortions and emergency contraceptives. And for the Jenison woman I spoke to today, she wanted to share her story so that people understand the real-life impacts, even right here in our own communities. Emergency contraception versus medication abortion.
It's probably a good idea that people get education about the difference between these, because a lot of times they get used interchangeably.
Governor Gretchen Whitmer and the Michigan Department of Health and Human Services are on this education effort, something the Pregnancy Resource Center in Grand Rapids says they know is important.
Plan B, what is it? How does it differ from the abortion pill? How does the abortion pill differ from a surgical procedure? What are the risks involved for every one of them?
And for Jim Sprague, he says it all comes down to intent.
For Plan B or emergency contraception, typically a woman is taking that medication because she's concerned about keeping fertilization from happening, to not become pregnant. Now, with the abortion pill, the intent is different. Pregnancy has already been discovered.
The new public effort put on by the state will educate through local health departments, hospitals, clinics, and other medical organizations.
The pregnancy wasn't just ending itself, it was continuing, but the numbers were not good numbers.
In 2014, her blood levels were concerning, and she had an ectopic pregnancy.
My life would have been at risk had that pregnancy continued.
So her doctors suggested methotrexate injections.
The first round of injections did not end the pregnancy, so I had to have another round of injections. Not really a fun process. Not something I wanted to do. It was a sad and terrible situation. It was the worst Christmas of my life.
She says she wanted to share her story to show that there are many reasons that women may have an abortion or need to understand all of the options. And she agrees with the state's push for more education.
My life was at risk, and it wasn't a fun choice for me, and I needed access to a safe abortion.
Now, abortion does remain legal in Michigan following the decision in Roe, thanks to a temporary injunction at the Michigan Court of Claims. Emergency contraception, is legal and not subject to any changes following this decision in Roe, as it does replicate an entirely different medication. Juliet.
Thanks, Keely.